you all today. So let me start my sharing my screen. There we go. There we go. So hopefully everyone can see. So today I'm going to be talking about alcohol home delivery before and during COVID-19. So just before we get started, I'd like everyone to write in the chat one change in your life since March 2020. As I know Mike mentioned, I have been cooking a lot. So just put in the chat, one change that's been in your life. It can be big, it can be small. As Mike says, he's begun listening to podcasts, baking, just sort of thinking about all the things that have changed in this past year. I like that, spending more time focusing on yourself, family time. Well, the cooking more is positive, the violence unfortunate. Great. So given that we've seen these changes and whether they're everything from cooking to baking to puppies, it only makes sense that our alcohol consumption, a product that we use to celebrate, to cope, to mourn, would also have changed. But as we examine the changes to alcohol home delivery today and that have occurred over the past year, it's important to remember one key thing. The changes we've seen in alcohol policy over the last year are not unexpected. This was actually a trajectory that we've been heading in. It's just that COVID-19 accelerated everything. And the alcohol industry is very aware of this. This was a point actually pointed out by someone in the alcohol industry on a webinar hosted by Drizzly. So how did we get here? What does the data show? And what can we do to slow down and, if not reverse, then at least address and get in front of these changes? So today I'm going to start by talking a little bit about why we care about alcohol, something that I'm sure you all will know a lot about already, before talking about terms and definitions so we're all on the same page. I'll talk about the state of home delivery before COVID-19 and lay the legal groundwork, the policy landscape of what's changed and how we got here in terms of law. Before talking about alcohol trends and the impact that COVID-19 has had on them. And I'll conclude by talking about some next steps, where we can go from here. Why do we care about alcohol? At the most basic level, excessive alcohol consumption is a serious public health problem. And when we talk about excessive alcohol consumption, this is where most of the harms from drinking come from. And we're talking about binge drinking, which is consuming 4 drinks for a woman and 5 drinks for a man in one sitting. Heavy drinking, which is consuming 8 drinks for a woman or 15 drinks for a man. And any drinking by pregnant women or people under the age of 21. And at the most basic level, excessive alcohol consumption is risky, it's deadly, and it's costly. So it's risky. It's associated with crime, sexual assault, violence, falls, burns, motor vehicle crashes, sexually transmitted diseases, and more. We also know that excessive alcohol use is deadly. It's the 4th leading preventable cause of death in the US. Excessive alcohol use kills 1 person every 6 minutes, which means it's responsible for 95,000 deaths annually in the US, which is more than 3,500 deaths among people under the age of 21. There are also many alcohol-related chronic diseases, including everything from cancers to diabetes to liver cirrhosis, and once again, much more. In 2014, 3.5% of all cancer fatalities and 15% of all breast cancer fatalities were attributable to alcohol use. Excessive alcohol use is also costly. In 2010, alcohol misuse cost the United States $249 billion. 3/4 of that cost was related to binge drinking, and nearly 10% of that cost was due to underage drinking. The trends that we've been seeing is that both consumption and harms have been increasing. So alcohol consumption is rising, along with alcohol use disorders. And the biggest increases are among women, older adults, racial and ethnic minorities, individuals with lower educational levels, and family incomes. Alcohol-related harms are also increasing. Between 2000 and 2016, the death rates from alcohol more than doubled. Emergency department visits from 2006 to 2014 increased by 62%. And from 1999 to 2016, the annual deaths from liver cirrhosis increased by 62%, and the liver cancer deaths doubled. We also know that people with alcohol use disorder have a greater susceptibility to respiratory pathogens and lung injury, and they have a 2 to 4 times greater risk of acute respiratory distress syndrome, which is a key cause of death in COVID-19. At the beginning of the pandemic, the World Health Organization came out with a statement where they discussed the harms of alcohol consumption and how it can make a person more vulnerable to COVID-19. And they recommended that people should minimize their alcohol consumption at any time, and particularly during the COVID-19 pandemic. A big issue that has been and continues to be the case is access and availability. The research has shown that increased alcohol availability leads to increased alcohol consumption, which leads to increased public health and safety problems. So before we continue to talk about how much people are drinking and how they've obtained that alcohol, I want to make sure that we're all on the same page. So I'd like to discuss some basic terms and definitions. The first is the 3-tier system. This is the US alcohol regulatory system, which separates each tier of the sales process, so no one company can unduly influence multiple tiers. So in other words, the manufacturers produce the alcohol and sell it to the wholesalers, who then sell and distribute it to the retailers, who sell it to the consumers. The 3-tier process ensures efficient tax collection and creates a tracking system to remove tainted products from the market. The second term is direct to consumer. And this is the ability of alcohol producers, so breweries, wineries, and distilleries, to ship alcohol directly to consumers' homes. And the research shows that direct-to-consumer shipping practices often result in increased underage alcohol consumption and, in turn, alcohol-related harms. Now, the main focus today is going to be on home delivery laws. This is where restaurants, bars, or retailers are able to deliver alcohol to consumers' homes through either the use of their own employees or through a third-party delivery system. And something that's really come up during COVID has been curbside delivery. And this is where consumers purchase alcohol from a restaurant, bar, or retailer, and the business brings it to the consumer without them having to leave their car. So what was the state of home delivery before COVID-19? Now, data is limited, but the STOP Act State Performance and Best Practices Report has tracked the ability of retailers to deliver alcoholic beverages to customers who are not present at their retail outlet. And the most recent version of the SPBP is 2018, which has data as of January 1st, 2017, and that's what's publicly available online. Now, as of January 1st, 2017, 20 states permitted retailers to do home delivery of all 3 beverages. The rest either prohibited delivery of some or all of the beverages or had no law. You can see here's a map showing retailer home delivery of beer. And once again, this is as of January 1st, 2017. You can see that there are 14 states where home delivery was permitted, including Michigan. There are 11 states where home delivery was restricted, a variety of restrictions. 8 where it's prohibited, and 18 where there were no law. So it didn't say one way or another whether you could or could not deliver beer. This is a similar map for wine and similar numbers. Once again, 15 states permit it and 9 prohibit it. And Michigan is once again in one of the states that permits it, or did permit it, sorry, pre-COVID-19. And lastly, we look at spirits. There are fewer spirits, the states that allow retailer home delivery of spirits. 11 states permit it and 10 prohibit it, but not drastically different numbers. But you can see pre-COVID-19, Michigan prohibited the home delivery of spirits from retailers. During the pandemic, the Alcohol Policy Information Systems, APIS, has expanded to include coverage of alcohol laws during COVID-19. And they've tracked whether on-premise establishments could deliver to consumers' homes, and they backtracked and looked at how that was set up pre-COVID-19. they found that 28 states did not permit restaurants or bars to deliver to consumers' homes. Now, this is a map. They have the data in a chart. I took that data from their chart and put it into this map. You can see that 4 states outright permitted delivery from on-premise establishments. 17 states, sort of that middle green, permitted delivery with restrictions. So these restrictions can be anything on the type of product to the type of establishment. 2 of the states, Nevada and Maryland, permitted, but was very dependent on local law. It was up to the counties or the cities as to whether it was allowed. And 28 states did not permit delivery by on-premise establishments. So what's changed? How did we get to where we are today? Now, part of that has been the impact of COVID-19 and how that's changed how we function as a society. But a second part of that is that the legal landscape is changing. What's worked in the past may no longer work in the future. And so before we look at the state of home delivery now, it's important to discuss how we got here. So I'd like us to take us back and way back to pre-prohibition. Now, the issue of alcohol and how to regulate it and to prevent alcohol-related harms is not a new issue. This is something that our country has been struggling with and trying to figure out how to regulate for close to 2 centuries. Now, pre-prohibition, alcohol consumption in the US was on the rise. Between 1900 and 1913, beer production nearly doubled, and the volume of spirits on which taxes were paid grew from 97 million to 147 million. And as a result, drinkers and their families suffered many alcohol-related harms. There were high rates of liver cirrhosis and chronic alcoholism, and the increasing consumption among men led to high rates of domestic violence. The majority of drinking among men took place in saloons, and as such, saloons increased in number and in importance. In 1884, 663 of the over 1,000 Republican and Democratic conventions and primaries took place in saloons. Now, part of the issue and why there was so much consumption was the way in which the alcohol industry operated. There were several large brewers across the country. They would distribute alcohol, but they would also own the saloons. So for example, pre-prohibition, the brewers owned or had controlling interests in close to 80% of the saloons. They wielded enormous power over the retailers through the use of financial inducements, such as the extension of credit. And through these arrangements, out-of-state suppliers drove their retailers to sell as much alcohol as possible. And this often resulted in aggressive marketing campaigns and practices that were beyond the control of local communities. And as I mentioned, since the suppliers did not live in the same state as the retailers, they did not observe or suffer the harms that arose from this blatant marketing of alcohol and from the saloons. And the collapsing of the 3 tiers of alcohol production distribution was called vertical integration. So in 1919, the states ratified the 18th Amendment, which prohibited the sale, transportation, importation, or exportation of intoxicating liquors in the United States and all territories subject to the jurisdiction, so all states. Now, there were both harms and public health benefits from prohibition, which I will not be addressing today. But suffice to say that prohibition failed from an enforcement perspective. It was too severe, too inflexible, and really failed to consider individual states and their differences. So in 1933, states ratified the 21st Amendment, which repealed prohibition. And the most important, I guess it's 6 words of the 21st Amendment were that it allowed alcohol and then in violation of the laws thereof. So the 21st Amendment endeavored to minimize alcohol-related harms by delegating primary regulatory power to the states. They felt that the states at the time were more attuned to the alcohol problems within their borders and could respond faster than the federal government. And this has led to many different alcohol regulatory systems. For example, the control system that we have in some of the states in our country stemmed from the 21st Amendment. So after the 21st Amendment passed, the Supreme Court gave great deference to it. it repeatedly allowed states to enact laws that restricted alcohol sales under the authority of the 21st Amendment. However, over time, the Supreme Court began giving less deference to the 21st Amendment and more deference to the Commerce Clause. The Commerce Clause states that only Congress can regulate commerce, and states may not interfere with interstate commerce. The pendulum has swung to the point where the 21st Amendment has much less weight, and the Commerce Clause has much more weight, and state alcohol laws are being overturned as a result. This led to the first Supreme Court case I'd like to discuss, which is Granholm v. Held, and was decided in 2005. The holding from this case overturned state laws that permitted in-state wineries, but prohibited out-of-state wineries from directly shipping to consumers. And although this was an upsetting decision for the public health community, Granholm also reinforced that the three-tier system was, quote, unquestionably legitimate, and that states could still rely on the 21st Amendment and public health rationale to support their laws. But this case also left a lot of questions. One major question was, who did the case apply to? It clearly applied to manufacturers and producers, but did it apply to retailers? And that was the ground when the Tennessee Wine and Spirits Retailer Association v. Thomas case came about in 2019. Tennessee had a durational residency requirement, which required that the Tennessee Alcohol Beverage Commission, the ABC, not grant licenses to retailers unless they were residents of Tennessee for at least 2 years. However, two stores, Total Wine and More and Kimbrough Wine and Spirits, both applied for licenses even though they were owned by out-of-state parties with no ties to the community. Now, the Tennessee ABC felt that their durational residency requirement law was unconstitutional, so was planning to grant these two retailers licenses anyway. However, the Tennessee Wine and Spirits Retailers Association challenged the ABC and threatened to litigate if these licenses were granted. So the Tennessee ABC went to court to see whether the law was constitutional. Upon hearing that it was not, the ABC refused to appeal the decision. So the Tennessee Retailers Association appealed instead. Many times retailers are looking to overturn alcohol laws. In this case, they were looking to maintain the alcohol laws in place. As Mike mentioned, there were 22 amicus curiae briefs submitted from a variety of interested parties. And an amicus curiae simply means friend of the court. It's by people who are not direct parties to the case. And in this case, it included state governments, consumer groups, and alcohol industry representatives. Only one of the 22 amicus briefs specifically provided a public health rationale. And that was the one that was written on behalf of the U.S. Alcohol Policy Alliance and public health researchers and advocates. The case was decided on June 26, 2019 with a 7-2 decision. And they found that the Tennessee's durational residency requirement was unconstitutional. The court explained that while states have the power to regulate alcohol, they may not discriminate against out-of-state interests in doing so. So what are the potential long-term consequences of this court case? As I see it, there are two. The first is that state courts will have to decide how to interpret this decision and apply it to current alcohol shipping cases. Right after this decision came about, Robert Epstein, who is the counsel for the alcohol industry plaintiffs in Granholm v. Held, stated, "I was concerned it would be a very narrow decision, only knocking down the residency rule, but they went way beyond that. This opinion is so broad and so helpful to us." And he thought that at the time, pending cases that were challenging restrictions on state retailer shipping in lower courts in 4 other states, therefore had a greater chance of success as a result of this decision. The second consequence of this case was that members of the alcohol industry will likely use this decision as the basis for challenging other alcohol-related public health laws. And this appears to be Justice Gorsuch's concern in the dissent. He said, "Does reducing competition in the liquor market, raising prices, and thus reducing demand still count as a public health benefit, as many states have long supposed? And if residency requirements are problematic, what about simple physical presence laws? And the concern is that if and when these challenges occur, lower courts will be forced to try and interpret what the Supreme Court intended in terms of breadth, scope, and applicability to different situations. And this might be difficult. Justice Gorsuch also wrote, "The courts assure us that it will allow each state leeway to enact the measures that its citizens believe are appropriate to address public health and safety." Yet the court then proceeds to turn around and dismantle the long-standing judgment of the citizens of Tennessee on just these questions. What are lower courts supposed to make of this? The concern is that if successful challenges occur, the ability of state and local governments to enact evidence-based alcohol-related laws that benefit public health will be constrained, and this might lead to the erosion of the three-tier system. So all of this brings us to a recent case, Alabama v. Whitmer, which you all might be very familiar with as it stemmed from Michigan. In 2016, Michigan enacted a statute that permitted licensed retailers who had to be in state to get the license to offer home delivery. An Indiana retailer sued, stating that the statute violated the Commerce Clause as it did not allow out-of-state retailers to offer home delivery to Michigan consumers. In April 2020, the Sixth Circuit rejected the argument and upheld the statute as a valid exercise of the state's authority under the 21st Amendment. Indiana retailers appealed the decision to the Supreme Court, and a few months ago in January, the Supreme Court declined to review the decision. And this is a statement in and of itself. It basically upholds Michigan's alcohol delivery laws, upholds the lower court's decision. And while this was a great decision for public health, it's just the tip of the iceberg. We know that many more cases will be coming down the pipeline as the industry tries to erode the three-tier system and attack different public health laws. So now that we've discussed the changing alcohol landscape, let's discuss current alcohol trends and the impact that COVID-19 has had on them. I get asked why I was initially worried last March about alcohol consumption and the harms from it, and what led me to create and disseminate our study. And the answer is it was several things. First, when COVID-19 started, there was a wave of alcohol-related memes. I would see these everywhere. Everything from the COVID-19 survival tip, if you have a drink in each hand, you can't touch your face. Or the one on the bottom right, half of us are going to come out of this quarantine as amazing cooks, and the other half are going to become alcoholics. There is no in between. And there was stuff about homeschooling. So on the far left, homeschooling is going well. 2 students suspended for fighting, and 1 teacher fired for drinking on the job. And while these are tongue-in-cheek and they're funny, it was also concerning that this was the message that was going out about alcohol during COVID-19. The second issue was the sales data. Between March 1st and April 18th, data on alcohol sales from the Nielsen Company showed large increases. Overall data for those 7 weeks showed that in-store purchases were up by 21%, and online alcohol sales were up by 234% compared to 2019. At the time, it was unclear if individuals were increasing their alcohol consumption or only stockpiling alcohol. The third issue was that the states began to relax their home delivery laws. So you can see here is a map of home delivery laws for on-premises, bars and restaurants. And this came from the APIS data as well. It was much more intricate, post COVID-19, during COVID-19. So I only separate it into 2 categories, whether home delivery was permitted, and there are many restrictions, and whether home delivery was not permitted. And you'll see that only 14 states did not permit home delivery of on-premise during COVID-19. And Michigan is still permitted. They also looked at off-premise. And once again, there are 39 states that permitted off-premise to home deliver during COVID-19, and only 12 states that did not permit this. And Michigan, again, permitted it for off-premise. The fourth area was the previous research. Previous research shows that those who experience periods of economic or psychological stress often consume more alcohol. resulting in increased symptoms of alcohol abuse and dependence. So for example, adults in New York City reported increased alcohol use and binge drinking 2 years after the 2001 attack on the World Trade Center. People in China who were quarantined or worked in high-risk locations during the 2003 SARS epidemic and used alcohol as a coping mechanism was significantly associated with alcohol abuse and dependence after the outbreak. And studies of drinking behaviors after hurricanes and tsunamis have shown similar behavioral changes in alcohol consumption. Now, as of March, April 2020, the thought was that COVID-19 might have similar impacts on both alcohol consumption and related harms, but the effects were still unknown. In May of 2020, several alcohol policy experts wrote an article that discussed how COVID-19 might impact alcohol consumption. They argued for two different theories. On one side, they said that alcohol use and related harms may increase due to stress triggered by financial difficulties, social isolation, and uncertainty about the future. On the other side, they said that alcohol use and harms may decrease due to restrictions on physical and financial availability of alcohol. So this led us to several research questions, and I'll discuss 5 of them today. The first was, what were the rates of US adult alcohol consumption during the early months of the COVID-19 pandemic? The second was, are US adults who are more impacted or more stressed by COVID-19 reporting more alcohol consumption than those who are less impacted and less stressed? And what percentage of US adults reported that their alcohol intake had changed in the past 30 days compared to their drinking behaviors prior to COVID-19, and why? And I think that why piece was really important. How were US adults obtaining their alcohol during the early months of the COVID-19 pandemic? And did their rates of consumption differ depending on whether at least some of their alcohol was delivered to their homes? Now, you'll notice a few things. The first is we focused on adult drinking. Although we did not examine this, there's a lot of research on the relation between adult drinking and the home environment and underage drinking. And during COVID, there's been a lot of reports of increased domestic violence and child abuse, something we did not ask about in our survey, which is related to alcohol. So our survey was done online. There were 61 questions. We had demographic questions, questions related to alcohol consumption, and related to stress or lifestyle changes during COVID-19. We recruited participants from across the US through social media posts and emails sent via group listservs in May of 2020. Almost 1,000 people accessed the survey, and our final sample size was 838 people. The sample was mostly female, mostly white, mostly non-Hispanic, but this is a demographic breakdown that's actually consistent with most other online surveys. Around 1/3 of the sample reported having children under the age of 18 currently living with them. The majority of participants were between the ages of 26 and 64, with nearly half of participants between the ages of 35 and 49. So what did we find? Participants during COVID-19 consumed alcohol on an average of 12 days and 27 drinks over the past 30 days. 34% reported binge drinking, defined as having 4 drinks for a female and 5 drinks for a male in one sitting at least once over the past 30 days. And 7% reported extreme binge drinking, which was binge drinking 10 or more times within the past 30 days. Now, to put this in context, according to data from the NISDA, the National Survey on Drug Use and Health, in 2018, US adults consumed alcohol on 5 days and had 12 alcohol drinks over the past 30 days. 32% reported engaging in binge drinking, and 4% reported engaging in extreme binge drinking. And we can't make the statistical comparison since the surveys were conducted very differently, but the raw numbers are alarming. Now, there have not been many, but there have been a few other studies that examined alcohol consumption in the US in the early months of the pandemic. and they have found similar findings. In other words, consumption has increased. Next, we looked at the impact of stress. Participants who experienced very much or extreme stress due to COVID-19 consumed significantly more alcohol than participants who did not report these high levels of stress. And the top concerns during COVID-19 included having to socially distance, having to spend less time with family members and friends, and the fact that schools and daycares were closed. As a result, we focused specifically next on parents of children under the age of 18 who are currently living with them. And most of the parents reported that they had to help their children with distance learning. We found that parents who were stressed by having to help their children with distance learning drank 7 more drinks per month than parents who did not feel stressed by distance learning. These stressed parents were also 2 times more likely to report binge drinking than parents who were not stressed. When we look at drinking patterns, 60% of participants reported that their drinking had increased compared to before COVID-19. The reasons included increased stress, increased availability of alcohol because they could get it delivered and it was easily accessible, and boredom. 13% reported that their drinking had decreased compared to before COVID-19. And their reasons included diminished alcohol availability. For example, they weren't going out to restaurants and bars where they could drink, less free time, and less money. And 27% reported no change. And all of that previous data came from an article that was recently published, I think in December, and I'll put the link for that in the chat when we're done. This next bit of data is an article that will be submitted actually later today, and it's not yet in press. So how did people obtain their alcohol? 21% of people we found had at least some of their alcohol delivered. That's nearly 1 in 5, a little over 1 in 5. Of those, 60% had alcohol delivered from a liquor store or a restaurant or a bar. 16% had alcohol delivered from a grocery store, 18% from a third-party delivery service, and 6% from other places or services such as wine clubs or breweries or wineries. 69% had at least some of their alcohol already at home, and 72% had purchased at least some of their alcohol in person. And you'll notice those 3 numbers do not add up to 100 because people could check more than one. They could check that they had some alcohol delivered and had alcohol at home. So what was the impact of having at least some of your alcohol delivered? Adults who obtained at least some of their alcohol via delivery reported consuming significantly more alcohol, both number of days and number of drinks, than participants who obtained alcohol through other means. These same participants were also 2 times more likely to engage in binge drinking than participants who obtained alcohol through other means. Now, previous research has taught us 2 things which have been proven true by the COVID-19 pandemic. 1, when alcohol is more available, there's more consumption and related harms. And this is clear. Alcohol has become more available during the COVID-19 pandemic. Nearly a little over 1/5 of people are consuming at least some of their alcohol from home delivery, and those that are consuming more. And 2, when adults experience greater sociological, economical, or financial stress, they consume more alcohol. And this has also been shown true, that individuals experiencing greater stress or being more impacted by COVID-19, and especially parents stressed by distance learning, are consuming more alcohol. To continue to support, future research. Future research is needed, and to continue to examine rates of alcohol consumption, one of the studies that needs to be done is to continue to examine rates of alcohol consumption in 2 to 3 years, when we expect to see an even greater impact, as that's what's been shown after other stressful events, natural disasters, etc. We need studies that delve into policy differences by state and the impact that these changing policies have had on alcohol consumption. We need to assess the rate of underage alcohol consumption during COVID-19, and we need to examine the impact of changing home delivery laws on underage alcohol consumption. So where do we go from here? Now, to continue to support the three-tier system and prevent harms both associated with home delivery and direct-to-consumer shipping, the public health community must obtain more and better evidence in support of state laws and work with researchers and legislators moving forward. Which brings us to the 4 T's. We need to train, we need to track, we need to test, and we need to translate. So the first is train. There's a need for research on different types of alcohol regulation and the impact that these regulations have had on public health. This means that universities must continue to train people in public health, public policy, epidemiology, and the skills necessary to conduct this research. And we need to continue to push for funding, whether it's NIAAA, other government sources, Robert Wood Johnson, or the private sector. We need funding so that academics and think tanks can continue to conduct this research. We also need to continue to train and use state epidemiologists. As of 2019, out of a total of more than around 3,300 state epidemiologists in the country, there were 59 individuals working in the substance abuse field. Only 5 were alcohol epidemiologists. 5. Now, these 5 individuals work in Colorado, Minnesota, New Mexico, Utah, and fortunately for you all, Michigan. So we need to make sure that we use these resources, especially when we have access to them. It's also not it's not enough for only researchers and advocates in the public health community to understand the importance of alcohol regulation in protecting society from the harms of excessive alcohol consumption. It's equally important that the lawyers be trained as well, as they're the ones who will be defending these laws in court. So we need to train our attorney generals and other lawyers who will have to articulate this information in court in a passionate and meaningful way. We need our state attorney generals to also understand the role of the research and to connect to and take advantage of researchers and epidemiologists in their state. The second T stands for track. For epidemiologists and researchers to conduct these studies, state and local jurisdictions need to do a better job of tracking alcohol-related administrative and enforcement data. For example, a list of who has alcohol licenses and what type of license per jurisdiction is needed. It's important that this list be current, complete, and publicly available so that it can be studied. The third T is test. The Supreme Court has indicated that research on a law generally and on alcohol regulation specifically is often not sufficient. Instead, there's a need for specific research and evaluation of individual state and local laws. Now, it's unrealistic to argue that every state should evaluate every law every time, but it's necessary and doable that states conduct routine assessments. They should understand the impact of their laws on public health and the cost and burdens of these laws on law enforcement. Now, one example of this occurred in 2018 in the state where I live, in Maryland. The Maryland General Assembly established the task force to study state alcohol regulation, enforcement, safety, and public health. So the mission of this task force was essentially to study all things alcohol in the state of Maryland. They looked at every law, every bill, and everything that had to do with alcohol. They looked at how agencies were handling alcohol and who should be the ones regulating it. They compared our laws to other states and looked at the public health impact of alcohol in Maryland. The task force included legislators, members of the alcohol industry, representatives from law enforcement, and healthcare professionals. And in 2019, they produced several recommendations to improve alcohol regulation and enforcement in the state. The final T stands for translate. The public health community must be able to translate its findings in order to connect to policymakers and drive decision-making. So we need to take academic articles and research that are jargon-filled and have lots of acronyms and create short, digestible, oral or written talking points. By translating the data and the research in a manner that politicians can easily understand, it helps generate political will so these politicians continue enacting and fighting for alcohol-related laws. And part of that translation includes the development of tools to make research and data more accessible. For example, NABCA, the National Alcohol Beverage Control Association, has a COVID-19 dashboard full of data, and I'll put that link in the chat when I'm done. In the other times, it's the development of guidance documents. So for example, the National Liquor Law Enforcement Association recently put forth a guidance document full of best practices and recommendations about how to address issues of home delivery in our communities. And this includes everything from how to properly package and seal our alcohol to developing evidence-based policies and training for delivery drivers. So I would say don't give up hope and leave you with the 4 T's that we need. What's left is for us to train, track, test, and translate. Thank you so much for allowing me to come here and talk to you today. This is my email address, grossman.elyse@gmail.com, and I would be happy to answer any questions that people might have. Thank you very much.